Did you know that 1 in 300 youth has an undetected heart condition that puts them at risk for sudden cardiac arrest? As primary care practitioners, you are on the front lines when it comes to protecting young hearts from sudden death. And yet, studies show that cardiac consideration is an often overlooked area of assessment, with practitioners and parents largely unfamiliar with warning signs and risk factors that require follow-up. In fact, the standard approach to well-child checkups and PPEs can miss up to 90% of heart abnormalities. Consider the evidence. Up to 72% of sudden cardiac arrest is preceded by symptoms, which often go unrecognized. And in cases when an SCA victim had reported symptoms, up to 60% of practitioners did not consider a cardiac diagnosis. What's more, up to 49% of victims had a significant family history that should have triggered diagnostic testing. But as few as 15% of practices annually update their patient's history, which means changes in a family's heart health could be missed. Nationally reported data shows sudden cardiac arrest is a leading cause of death among youth, and arguably, it is the only one that can be prevented with tools we have available today. So why aren't we? Symptoms go unreported because youth aren't asked if they're experiencing them. Parents just check the box instead of thoughtfully completing health forms with their youth. A more comprehensive cardiac risk assessment at home and in the doctor's office could prevent the loss of thousands of youth each year. Don't take a chance with a child's heart. To help practitioners incorporate more robust cardiac risk assessment into their practice, the Eric Paredes Save a Life Foundation has created the first accredited on-demand, no-cost medical education module. Narrated by Dr. John Rogers, the training discusses recognizing and responding to warning signs and family history that can put youth at risk for sudden cardiac arrest. Here's a preview of what you'll learn.
In 2021, the American Academy of Pediatrics added sudden cardiac arrest and sudden cardiac death assessment to Bright Futures, their recommendation for preventative pediatric healthcare schedule. This was a landmark event, given that it's the first time regular preventative heart care has been included in the periodicity schedule. The guidance calls for all youth, not just student athletes, to be regularly screened for heart issues that put them at risk for sudden cardiac arrest. These screenings should occur at least every 3 years and ideally during annual well-child checks and pre-participation physical evaluations, also called PPEs, and especially upon entry into middle, junior, and high school. It's important to note, however, that while we are focusing on this age group, a child with any of the warning signs we just discussed or who has a serious family history should be assessed. To clarify, Bright Futures also recommends pulse oximetry testing for newborns for congenital heart disease, but the screening is unlikely to address the heart conditions most commonly underlying sudden cardiac arrest in young people. So practicing robust cardiac risk assessment as your young patients age is important. Also, a note about sports physicals. Many schools and sports programs offer mass physicals that occur in one day in places such as school gyms. The American Academy of Pediatrics recommends against these physicals and against using urgent care settings for these physicals because in order for the evaluation to be accurate and thorough, it needs to be completed by a healthcare provider who knows the youth and has access to past medical records. Which means, even if your patients say they've had a PPE elsewhere, it's important to perform your own cardiac risk assessment. There are several existing tools that include cardiac risk assessment, such as the American Heart Association's 14-point evaluation and the PPE monograph. Unfortunately, we know from surveying pediatricians that too many physicians don't use or don't know about these tools. Likewise, though Bright Futures has been updated with new heart screening guidelines, we know many practitioners are not aware of the revised protocol, so let's review that now. The recommendations call for practitioners to know the warning signs and risk factors for SCA and to conduct a thorough personal and family history and physical to uncover them. Practitioners are also given 4 questions to annually ask youth. We'll look at the first 2 questions now. 1. Have you ever fainted, passed out, or had an unexplained seizure suddenly and without warning? especially during exercise or in response to sudden loud noises such as doorbells, alarm clocks, and ringing telephones. 2. Have you ever had exercise-related chest pain or shortness of breath? Yes answers to questions should always trigger follow-up diagnostic testing, typically starting with an electrocardiogram. Here are the next 2 questions. These are about family history. Has anyone in your immediate family, parents, grandparents, or siblings, or other more distant relatives, aunts, uncles, cousins, died of heart problems or had an unexpected sudden death before age 50? This would include unexpected drownings, unexplained car accidents in which the relative was driving, or sudden infant death syndrome as well. Are you related to anyone with hypertrophic cardiomyopathy or hypertrophic obstructive cardiomyopathy, Marfan syndrome, arrhythmogenic right ventricular cardiomyopathy, long QT syndrome, short QT syndrome, Brugada syndrome, or catecholaminergic polymorphic ventricular tachycardia, or anyone younger than 50 years with a pacemaker or implantable defibrillator. Practitioners should order genetic testing if there's a family history of sudden cardiac arrest or heart conditions.
In less than 90 minutes, you can update your skill set around cardiac risk assessment when you take the complete Prescription for Prevention course, with detailed instruction on how to recognize and respond to warning signs and risk factors in your patients. Visit the Institute for Public Health at San Diego State University to create a free account when you click Online Courses Login. Once logged in, Cardiac Risk Assessment in Youth is listed under IPH courses. For more information about this and other free sudden cardiac arrest prevention resources for youth, families, schools, sports teams, and medical professionals, visit epsavealife.org.